Hi, it's Mary, a traditional Chinese medicine tutor and an acupuncturist in Canada.
Today's video will discuss scattered and feeble pulses, which indicate critical conditions where the Zangfu organ qi is on the verge of exhaustion. However, these two pulses are not similar in their pulse features. A scattered pulse is mainly characterized as floating without root, irregular in rhythm, rate, and strength, and hard to determine how many pulsations in a minute. A feeble pulse is described as extremely thin and soft, not palpable with light pressure, and not evident under heavy pressure. Scattered pulse.
The scattered pulse, it is rootless under heavy pressure, arithmetic, randomly rapid, and slow. It disappears under light pressure. A scattered pulse has the following features. 1. The pulse depth is shallow, as if it just runs underneath the skin. The pulse can be felt by lightly touching the skin. 2. The pulse is floating without a root. When you try to locate the pulse with a little more pressure, you become unsure whether it is there. If you press harder using heavy pressure, it disappears, giving you a feeling that the pulse is floating without root. 3. The pulse rhythm is irregularly irregular. You cannot determine the rhythm of the pulse when you feel it. Sometimes the pulse beats faster, sometimes slower. The pulse strength is weak in general but uneven. Sometimes the beat becomes more evident and you can feel it. Sometimes it becomes weaker and seems to disappear. It is hard to determine pulse rate, such as how many beats there are in a minute. The Asians describe the scattered pulse as if palpating the white fluffs from willow trees in spring blown by the wind, which flies around, coming and going without a fixed direction and challenging together. Scattered pulse suggests a depletion of primordial qi and the qi exhaustion of the Zangfu organs. It occurs in severe diseases due to weakness of qi and blood and desertion of the primordial qi. It's rootless, without root. Arithmetic, so it's uneven. When you say it's uneven, that's a lack of stomach qi. Rootless means there's no kidney qi. It's a very serious situation.
Feeble pulse.
Feeble pulse is exceptionally thready and soft, palpable faintly. Very difficult to find this one. Feeble pulse is extremely fine and soft, almost impalpable on pressure. And the exact beats cannot be counted because it rises and declines faintly. The feeble pulse has the following features. 1. The pulse shape is very small, short in length and narrow in width. 2. The pulse strength is very weak. If you use light pressure to palpate the pulse, you cannot feel it. If you press hard, the existence of pulsation is not evident. A feeble pulse is even weaker than a weak pulse. We discussed the thready, soggy, and weak pulses before. Together with the feeble pulse, all have thin and soft pulse features. However, the difference between them is significant. A thready pulse is thin and soft, but quite sensible under pressure. A thready pulse can appear in an excess syndrome, and its pulse strength does not have to be weak or forceless. A soggy pulse is thin and soft, but floating. It feels weak and sensible under light pressure, but not evident under heavy pressure. A weak pulse is thin and soft but deep, sensible only under heavy pressure. A feeble pulse is extremely thin and soft, almost insensible under pressure. Feeble pulse, it suggests extreme deficiency of qi and blood, weakness and decline of yang qi. Extreme blood deficiency cannot fill the vessels. The pulse is thin or thready. Weak yang and feeble qi cannot expand the vessel. Therefore, the vessel is soft, almost impalpable. Remember, The characteristics of yang are warming, moving, ascending, and expanding. Any movement, change, or function of our zangfu organs requires yang qi to make it happen. When yang qi is insufficient, the power to propel the pulsation will decline. Thus, the pulse will be weak. When the yang qi is about to exhaust, the pulse beat will be feeble and can hardly be detected. When it seems impalpable under light pressure, it signifies yang exhaustion. When it seems imperceptible under heavy pressure, you use heavy pressure, but you cannot find it. That represents yin exhaustion. When it occurs in a protracted disease, it suggests exhaustion of the healthy qi. When it occurs in a recent disease, it indicates a sudden collapse of yang qi, feeble pulse. It's usually associated with a very severe situation. Clinically, it is not uncommon to run into such a condition that at its initial stage, due to the exuberant pathogenic heat, the patient has high fevers, profuse sweating, and a large amount of yin liquid has been consumed. This is an excess heat syndrome. If this high fever continues for long, the condition can suddenly change to the opposite, followed by the symptoms of dropping body temperature, cold limbs, and pale complexion. And their blood pressure will drop quickly, even causing cold sweating throughout the entire body. At this moment, if you palpate the pulse, you will find the pulse is hardly perceptible. This is a feeble pulse happening in a recent disease, developing into a critical condition of yang depletion. A feeble pulse means extremely insufficient qi and blood and yang depletion. Thus, when it is detected, whether in the recent or prolonged disease, prompt treatment of rescuing and restoring yang are required. At this point, any actions that will further consume the body's yin fluid, such as inducing vomiting, sweating, diarrhea, etc., are inappropriate. If you find this video helpful, please give me a like, subscribe to it, and share it with others. See you in my next video. All the best!